Hello, everyone. Welcome to Lump Basics or Lump TCM and Acupuncture lectures for beginners. We are now on episode 64, the final episode. Okay, let's start with the first one. Let's talk about menstruation-related headaches. If a woman demonstrating age comes to you with headache, 9 out of 10 times it will be related to her menstruation. So how does one differentiate this headache from others? So here we have three different patterns: liver blood stagnation, hyperactive yang in the liver and kidney, and liver blood deficiency. So for headache secondary to liver blood stagnation, mostly the pain would be on the vertex or unilateral. The side may vary. Headache is premenstrual and it improves with periods. So before menstruation, the headache sets in. Other symptoms are premenstrual tension, water retention, breast distension, irritability, constipation, nausea, coldness, and lower abdominal heaviness and discomfort. The character of the headache can feel heavy, pressure from outside to inside. So it's like wearing a helmet. Worse in the nights and on waking, better in the day, improves in fresh air and with black coffee. So tongue, purple on the sides, with teeth marks, slimy or slippery white coating. Now let's go to headache, secondary to hyperactive yang in the liver and kidney. So this is mostly one-sided at a time or at the point where the bladder 2 acupuncture point is located. So headache can be with maximum bleeding or during ovulation time. Other symptoms, generally short cycles, feels hot before and during period, vomiting with headache, photophobia and phonophobia, prone to yang-type backache, and occipital pain, abdominal colic, and diarrhea during menstruation. Headache feels sharp, pulsating, pressure as if the head would explode. Better at night and while asleep, better if they can eat, worse with stress and activity. Tongue, red on the sides with cracks or red papillae. Now let's talk about headache. Secondary to liver blood deficiency in women. Fairly generalized in the head, the entire scalp is sore. The most pain points could be on the side or vertex. Other symptoms associated with it are dizziness, blurred vision, tinnitus, poor sleep and concentration, weakness of the limbs, pale and drained. Headache will start at the end of menstrual bleeding. So now we can categorize the headaches into three. So with liver blood stagnation, the headache will come before the menstruation. We'll have hyperactive yang in the liver or kidney during menstruation. And all the liver blood deficiency, the headache will be at the end of the menstrual bleeding. And this will last for 4 to 5 or more days. It is dull because it's blood deficiency with a very hypersensitive scalp. There is feeling of emptiness in the head, so that it's very blood deficiency. Sore, sunken eyes, pale gray face. The tongue is pale on the sides, thin and dry coating. And for treatment, for the headache, secondary to liver blood stagnation, we use bladder 18, GB37, stomach 40, Li4, local points, plus local points. Treat 3 to 4 sessions in mid-cycle for 3 months. For headache, secondary to hyperactive yang in the liver and kidney, we use REN 3, kidney 4, bladder 40, spleen 6, local points. Treat once weekly for 3 months. If the headache is secondary to liver blood deficiency, we use REN 13, bladder 15, bladder 17, GB39, plus local points. And we supplement with iron and proteins, treat once weekly for 3 months. Okay. Now, the next table will somehow summarize or uh, give us a recap of what we have taken up for the water element. So with kidney yin deficiency, the energy is better after rest and at night, and quickly exhausted. Actually, the best I can relate to this because I feel more energized in the evenings. Okay, for kidney yang deficiency, the problems with starting the day, the energy is better at noon and in warm weather. And this is understandable because the yang is very deficient. With kidney yin and yang deficiency, as you can see, it's very chronic. Both yin and yang are depressed. So the patient is always tired, and he would report feeling better at 3 to 7 p.m., which are the maximum time for bladder and kidneys. Now, for the hyperactive yang, very energetic for short periods, very active, but they are better at night. Okay. With stagnation of fluid, so there's a lot of retention, takes a long time to get active. So you will notice that the ankles are swollen because there's fluid retention. So takes a long time to get active. Worse after rest and in wet weather. For urinary bladder hyperactive yang, same as hyperactive kidney yang, because we always consider the yang coupled organ as the yang component of the kidney. Okay, and urinary bladder stagnation of dump is the same as stagnation in the kidney. Okay, so let's talk about the characteristics or the symptoms associated with each pattern. With kidney yin deficiency, small and weak bones, and you will notice that there are easy fractures with dental caries, okay? And menstrual cycles are short, and the patient keeps having miscarriages, short erection, okay? And with regards to skin and urine, it's dryness, little and concentrated urine, and there is osteoporosis, nerve atrophy, general hot pains in the joints. So with kidney yang deficiency, short, slow growing, and lazy. Long menstrual cycles, infertility, amenorrhea, poor erection, increased night urination, generalized cold pain in joints with coldness. So for kidney yin and yang deficiency, short and underdeveloped, irregular cycles, infertility, premature ejaculation, frequent urination, excessive thirst, dryness, osteoporosis, pain in joints all the time. For patients with hyperactive yang, grows very fast and weak, small bones, fractures. So mabilis tumangkad but weak, and they are prone to fractures. Short cycles with excessive bleed. Yeah, that's very young. Repeated miscarriages, short erection. Acute kidney colic, acute pyelonephritis. Acute relapse of RA, rheumatoid arthritis, hot pains with feverishness. So for those with stagnation of fluid, they're usually short with large joints and heavy bones. Long cycles with dysmenorrhea before period, cannot get pregnant, poor erection. Chronic impairment of kidney function, there is edema and less urine. Generalized dump pain in joints with edema and stiffness. For urinary bladder hyperactive yang, there is yang pain in the back, weak back, short cycles with dysmenorrhea, during bleed, repeated miscarriages, acute cystitis, nervous and frequent little urination, acute backache with sciatica, worse with movement. For urinary bladder stagnation of dump pain in the back, stiff back edema, uterine fibroids, hypertrophy of prostate, long menstrual cycle, endometriosis. Urine retention in the bladder with no urge or poor elimination. Damp pain in the back, worse at the start of movement, pressure pain on sciatic nerve. So for the associated symptoms, we have for kidney yin deficiency, there is tinnitus, selective deafness, autosclerosis, loss of hair, thin and brittle hair, active fear. Fear causes physical symptoms of hyperactivity. Kidney yang deficiency, there is nerve deafness, limp and dull hair, and grace early. Phobia, passive fear, can faint or urinate involuntarily. With kidney yin and yang deficiency, chronic deafness with tinnitus, both yin yang deficient symptoms, always in fear of unknown causes. So these are the usual these are usually the people who would seek psychiatric help. Hyperactive yang, acute ear infection, tinnitus, hair loss and thinning, brittle hair, mostly fearless, in an acute state, could be panicky. Stagnation of fluid, blocked ear, Meniere syndrome, greasy, dull, and limp hair, grace early. Madaling pumuti ang buhok. Okay. Passive even when not feeling fearful, more passive when feeling fearful, argues why they are right. With urinary bladder hyperactive yang, there is loss of hair on the occiput, same as kidney hyperactive yang. Okay, kidney yin deficient people, they like deep blue and black, can be therapeutic colors for them. Salty food is beneficial to hold water in the body, but causes hardening of arteries, not suitable in patients with cardiac or blood pressure problems. If yin deficiency is severe, feels cold in the interior, improves after eating or sleep. Kidney yang deficiency, they like sky blue and pastel gray. Crave salty foods, can be consumed when there is no water retention. So you have to really examine your patient. You have to really assess your patients very well. Cold inside and outside. Sometimes they do not feel their feet are cold, but can be icy to touch. Improves with exercise. So for those with both kidney yin and yang deficiency, they like all shades of blue and black. They crave salty foods. They may have edema in the ankles. Salty food can be taken if it does not increase the edema. They feel cold all the time, inside and outside. The feet, however, feel sometimes hot and sometimes cold. So for those with hyperactive yang, they feel calmer in deep blue or at night. So this time you will have, you would know how to advise them with regards to how they would paint their rooms. They dislike salty food. They feel cold inside, especially the bones, and they are hot outside, and there is ascending heat. Stagnation of fluid, grays and deep blues make them feel as if underwater. Dislike. So they dislike these colors. Crave salty food, not to be taken because of the edema. Cold and wet in the lower part of the body. For urinary bladder hyperactive yang, they like deep blue and black. They dislike salt. Backache worsens with activity, bladder inflammation with overwork. For urinary bladder stagnation of dump, they like sky blue and light gray. They crave salt, should be avoided. Backache worsens with rest, and cold bladder infection with exposure to cold. So this table will help with the differentiation of kidney yin and yang. It should not be confused with the table that we have shown earlier, okay, in our past lectures, the differences between the water kidney and the Mingmen kidney. So with kidney yin, think of water, essence, life, past, passive fear, the marrow, bone, nerve, refinement, right brain dominated, endurance, flexible back, soft, lazy, lenient, quantity, and barren. Kidney yang, distribution, elimination, energy, force, future, active fear, sensitivity, function, hearing, left brain dominated, libido, sex, rigid back, hard, active, strong, urination, and fertile. Thank you very much for your attention, and we hope you were able to digest everything that we took up during for the water element. Thank you. Let's now listen to Ma'am Teresita Sumile for the wood element. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon, everyone. Now let's talk about the wood element. The coupled organ of the liver is the gallbladder. The gallbladder and liver are coupled organs because they have an exterior-interior relationship. Each time there is an excess of yin or yang in one organ, it flows through the interior collateral into the coupled organ, causing a similar excess in that region. If there was a yin or yang deficiency in one organ, then energy would flow in automatically from the coupled organ in order to fill that deficiency until both coupled organs had a new lower level of yin or yang. But the gallbladder has symptoms of its own. It is an organ that stores and releases bile. A functional Qi deficiency in gallbladder can cause problems in digesting fats, causing hypochondrial pain and distension, followed by pale yellow-colored fatty stools. A sluggish gallbladder function can cause bile stagnation, which could lead to cholecystitis or damp heat in the gallbladder. So it is shown in our tower diagram that at first, damp heat, there is an excess of blood and yin and yang is healthy and qi is deficient. Then later, blood still remain in an excess state, yin still remain healthy, but yang is increasing and qi remains deficient. So that is the pit in the gallbladder. Now we have here symptoms like long-sightedness, liver qi deficiency with yin stagnation. So for treatment, same local and distal points as for short-sightedness. Energy balancing points, we use UB18, the Bakshu point of the liver, gallbladder 37, the loop connecting point of the gallbladder, which tonifies yang and sedates yin. The most effective point is gallbladder 20. Effectiveness depends on the severity and chronicity of the visual impairment. Present and mild problems improve quickly and do not reoccur. Next symptom is long-sighted conjunctivitis. Liver and lung yang excess, recurrent yang excess. Then for treatment, not many local points are used. For local point, use X2, theta yang. Then for distal points, use Li4. For energy balancing points, we use gallbladder 20, wind elimination sedation, which eliminates wind heat. Liver 6 sedation, the Shicklef point. Lung 6 sedation, the Shicklef point, not always necessary. When recurrent, give these points in between. Liver 5, loop point, which tonifies yin and sedates yang. Lung 7, same as above. By stimulating the loop point when the yang is not high, we can prevent the yang from rising. This type of preventive treatment is usually done in recurrent. Next is iritis. Liver yang excess. Same treatment as conjunctivitis, but treat only liver, not lung. The next is optic neuritis. For treatment, use local point, stomach 1, gallbladder 14, AX2, and distal point, LI4, and liver 3. Effective point is gallbladder 20. Tonification or sedation techniques are not used unless there are symptoms related to irritation or lacrimation. No wind elimination is done. Often, optic neuritis is an early symptom of multiple sclerosis. Treating it as early as possible will not only relieve the eye symptoms, often some pain and focusing difficulties, but also abort the multiple sclerosis disease process. Okay? Thank you for your attention.
Thank you very much, Ma'am Teresita. We now proceed to wood element diseases. Let's welcome Sir Dino Pinheiro, Certified Associate Acupuncturist from Legazpi.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the wood element diseases. First, we have the liver, which stores and releases blood. The yin problem storing blood, delayed coagulation. Excuse. The blood, which is there is pale, dizziness, extremities easily go numb, long menstrual cycles with scanty bleeding. Sa liver fire, there is excessive spontaneous bleeding, red face, hypertension, poor sleeping, pulsating headache. Sa liver wind, there is wind heat symptoms with liver fire or wind cold symptoms with blood deficiency, wandering, paroxysmal, irritating, or blocks. Sa chi, there cannot eliminate or circulate blood freely. There's blood stagnation, dysmenorrhea at onset of menstruation in the endometriosis, premenstrual tension. And next, there is blood deficiency, low blood pressure, menstruation, one time heavy bleeding, the next time it is scanty. Next, we have the liver secretes bile and controls muscles, tension, and strength. Sa yin, always tense, finds it difficult to relax, nervous tics, tremors. Sa blood, there is poor endurance, weak muscles. Sa liver fire, could be jaundice with dry, itchy skin. Very tense muscles, cannot relax, colic, spasm, strong muscles. Sa liver wind, there's vomiting, pyloric spasm. Tremor or tics, wind block, may cause unilateral paralysis, wandering muscular pain. Sa chi, there is less bile, cannot tolerate same as chi or digest milk, foods, fatty yellow stool. There's flaccid muscle, low vessel wall, tension, cause low blood pressure. And there is weak and flaccid muscle, inner tremor, at times of nervousness, nervous and restless. Okay, sa liver, nourishes and controls tension, opens to the eye, sight, and tears. Okay, sa liver yin deficiency, there is hard contracted tendons, difficulty in extending, easy ruptures, poor healing. There is dry eyes, recurrent conjunctivitis, strabismus. Sa blood deficiency, there is weakness of tendons, easy to strain, blurred vision, optic nerve atrophy. Sa liver fire, excess of yang, deficient yin, there is acute tendonitis, inflamed and painful with radiating pain. Conjunctivitis, red, painful eyes. Sa liver wind, there is deficient blood, excess chi. There is nystagmus, irritated by wind, causing lacrimation. Sa Qi deficiency, there is weak tendons, hyperextension of joints, poor stability, short or long sight, strayed eyes when tired, poor adaptation to light changes. Sa both liver, blood, and Qi deficiency ng liver, there is weak and soft tendons, severe instability similar to Qi, excess lacrimation changing with dryness. Okay, sa liver yin deficiency, there is a quickly angry, lose control when angry, and never miss a fight. Crave sweet, sour, cream sour. Sa liver blood deficiency, irritable, angry when tired and weak, likes meat, salt, and sour. Sa liver fire, excess ang yang, aggressive person, loud voice, powerful, bitter sour food, worsen symptoms. Sa liver wind, excess ang qi, deficient ang blood, irritable, aggressive, if they are itching and sneezing. All sour foods worsen wind and symptoms. Sa qi deficiency ng liver, cannot shows anger, soft voice, but can be angry and tense inside. They crave sour, bitter sour, and dislikes milk. Sa liver deficiency, both of blood and qi, always angry, irritable, aggressive for no reason, there is leaking anger. Craves all sour foods, but sour foods worsen symptoms. Thank you for listening.
Thank you very much, Sir Dino. Let's welcome Ma'am Lynn Galarita for topic number 4. She will present the metal element for the last time.
Good afternoon, everyone. Good afternoon, Dr. Hector. Today we'll summarize the different diseases of the metal element, which is the lung, TCM, organs, and how these different diseases impacts or manifests in the different lung functions. So let's start with how these patterns or diseases first impact on the lungs function of governing the immune system and waste elimination, and also of regulating water metabolism, and also in the lungs control of respiration. So in lung immune deficiency, it will present with sensitivity to sun, to pain, where the skin is more dry and contracted to sweat, and coughing will be dry, there will be pain in the throat and chest. In lung yang and qi deficiency, we see people with poor immune system, frequent respiratory infection, there is spontaneous sweating, and cold skin. Breathing is also shallow, and there is a tendency to snore, and there is sleep apnea. In conditions where there is damp heat in the lung, there is harmful heat that suppresses the functional qi of the lungs, so the immune system is affected. So there is excessive hot sweating and coughing with much yellow or green mucus is usually seen. There is fever, chest pain, and asthmatic breathing. In damp cold in the lungs, there is poor immune system, so there is recurrent breathing problems, which is worse in wet and cold weather, at nights and early morning. Cough will be with excessive white mucus and asthmatic breathing at nights and wet cold weather. In yin condition of the large intestine, the large intestine function is poor, either semi-solid stools or constipation with no urge to go to the toilet, and there is fullness and distension. So In young condition, large intestine, there is dry and dark stools or frequent and urgent tenesmus, but little stool and maybe with pus or blood. Okay. In lungs function to open to the nose and to smell and relationship to mucus production. In lung immune deficiency, there is dry mucus and dry mucous membranes. There is hypersensitivity to smell and sneezing with itchy nose. While in lung yang and qi deficiency, there is anosmia, constant runny nose, worse in wet and cold weather, and there is chronic blocked nose. If there's damp heat in the lung, there is acute common cold or sinusitis, blocked nose alternating with excessive yellow-green mucus. Smell may be affected. In damp cold in the lung pattern, there is subacute or recurrent blocked nose, poor sense of smell, runny nose in wet, cold weather, and there is watery mucus. Regarding the lungs function of nourishing the skin and body hair, in lung yin deficiency, there is thin, dry skin. The skin sunburns easily. There is less body hair. There are problems with getting a tan. This kind of patient sweats very little, and as the yin is low. In lung yang and qi deficiency, the skin is dull. There's spontaneous sweating. There's problem to adapt to temperature changes in climate. In damp heat in the lung, there is red inflamed skin, urticaria, sunburn, acne vulgaris, and can show pustules and bleed when injured. If there is damp cold in the lung, there would be thick skin and maybe dry on surface or could be oily. The skin cannot easily eliminate sebaceous secretions and may have acne. Okay. Regarding its impact on the emotions, where everyone's ability to attach or detach from sadness. In lung deficiency, patients with this condition are usually unable to feel sadness when sad, feels angry instead. They're unable to stay in a relationship. Since the yang tends to rise, these people dislike rules and laws that curtail their freedom. In lung yang and qi deficiency, we can see patients who are unable to cry when sad in their own sweet, sad state. They need relationships, they need leadership and fearfully respect authoritative figures and unable to get out of relationships. In damp heat in lung, there's emotional and crying, and their sadness should be the foremost thought for all around them, like saying, "How dare you enjoy when I am miserable?" And people with damp cold in lung, there's feeling of sadness causes interior problems like pressure in the lungs, dermatitis, acne, tumors, and angina pectoris. If there's yin condition in the large intestine, there's constipation for long periods and cannot defecate without laxatives or enema. There's also abdominal fullness and distension. For young condition of large intestine, there's urgent and painful stools with colic and much wind. Fear for relationships may cause nervous diarrhea. Lung yin deficiency, people like off-white colors and beige, mustard, yellow, which gives yin from mother. Well, Lang Yang and Qi deficient people or patients likes brilliant white and all pastel shades, especially yellow. In damp heat in the lung, they dislike white uniforms, dislike police, army, or any other person with authoritative power. They would like to be the one to make the law. Damp cold in lung, they're very proud if wearing special uniforms, like work for clothes with a name badge. Feels important when given a job to do, but does not wish to take the initiative or make decisions. In people with yin condition of the large intestine, they like white, especially in toilets. In yang condition of the large intestine, they prefer colors that control large intestine yang, the lilac and deep maroon. Okay. Regarding preference to spicy flavor, lung yin deficiency has high sensitivity to spicy food, may get irritated nose or skin, and difficulty breathing. In Lang Yang and Qi deficiency, they love spicy food, eats more than the usual amounts eaten in their country. In damp heat in the lung, they completely dislike spicy food. Their symptoms worsen greatly if they consume this food. In damp cold in the lung, spicy food actually improves their skin elimination or the feeling of blocked nose and throat. Where there's yin condition in the large intestine, spicy food helps the constipation and make wind pass outward. They feel comfortable after consuming this. And in yang condition, large intestine, spicy food makes the diarrhea, pains, and wind very much worse. So in association with the dry climate, in lung yin deficiency, all symptoms of breathing and skin worsen in dry weather. While in lung yang deficiency, symptoms slightly worsen in closed rooms and stuffy weather. Where there's damp heat in the lungs, they need fresh air and windy climate. If there's damp cold in the lungs, they feel bad in wet cold weather and better in dry warm. In yin condition large intestine, stools are not particularly affected by dry weather. And as for the elimination of this waste, stools tend to be either light and semi-solid or long-term constipated with fullness and distension in abdomen. Even if there are stools, the fullness and discomfort are present. Finally, in yang condition large intestine, when they have a constipated period, dry weather can make this dry constipation very much worse. Stools go between constipation and diarrhea. The constipation is very dry, dark, looks like rabbit stools, and the recurrent diarrhea comes on with emotional problems or certain foods. So this caps our discussion on the diseases of the metal element. Thank you for your attention.
Thank you very much, Ma'am Lynn. I'm sure everybody was able to find that presentation very helpful indeed. So let's now proceed to the fifth topic. Let's welcome once again Ma'am Teresita Sumile for a review on the theory of Zang Fu organs.
Good afternoon po, Dr. Hector, and sa lahat na po. Now let's take up first heart. Heart governs blood, so heart is responsible for blood circulation. It controls blood vessels, including the pulse strength. It houses the mind or shen, the spirit, the mental activity, memory, consciousness, thinking, and sleep with dreams. Responsible for happiness and joy. It manifests in the complexion, particularly the face color. It opens into the tongue, especially the teeth. The condition of the heart also affects the speech. It controls sweat. Next is the spleen. Spleen governs transformation and transportation, as in food and drink, soap, preventing water retention. It controls racing function, keeps internal organs in place, and sends essential substances, especially the clear chi, to the head. It keeps the blood within the vessels, preventing hemorrhages. It controls muscles and the four limbs for energy. It opens into the mouth and manifests in the lips. It controls saliva, and it houses the thoughts for clear thinking. Next is the liver. Liver stores blood for regular activities and menstruation. It ensures the smooth flow of qi for energy, mental state, and digestion. It controls the tendons or sinews. It is in charge of movement like the muscle, ligaments, and tendons. It manifests in the nails, good for diagnosis, observation. It opens into the eyes. It corresponds to tears, moistening and protecting the eyes. It houses the ethereal soul, as in finding direction in life and visions. Next is the kidney. Kidney yin and kidney yang are the root of the genes. If one is diseased, the other will be too. Kidney stores essence and governs birth, growth, reproduction, and development. They produce marrow, fill up the brain, and controls bones. They govern water. The reception of qi is from the lungs. They opens into the ears. They manifest on the hair. They control the lower orifices, like spermatic duct, urethra, and anus, the opening and closing function. They house the will power, as in motivation, and the kidney is the gate of vitality or Mingmen. Between the two kidneys, it provides heat for all body functions, warms lower burner, stomach and spleen to aid in digestion, harmonizes sexual function, support all other organs, warm the kidney yang and nourish kidney yin. Lung in Chinese medicine. Lung governs qi and respiration. It extracts the good qi from the spleen and sends it all over the body. It controls all meridian circulation of qi. It controls descending and dispersing. Descending sends qi to kidney, purify qi to keep it clean, and dispersing spread defensive qi to the skin to help fight diseases. Regulates water metabolism. It controls skin and body hair for body resistance. It opens into the nose and controls the nasal discharge. It houses the corporal soul, physical strength, mind, and body connection. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Let's now call once again Ma'am Lynn Galarita, Sir Dino Pinheiro for the water element.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the water element, musculoskeletal pain. The clinical example, number 6, the energy treatment of musculoskeletal pain. A woman aged 54 came to me with pains in nearly every joint of the body. The pain started 2 to 3 months ago. All the pains were worst in the early hours of the morning, and she felt so uncomfortable in the bed that she had to get up. When she did, she was stiff everywhere, could not bend or move her neck, Her feet were too stiff to walk properly, and her fingers had no gripping power. The severe pain improved around midday, and then she felt more supple as the day went on. She was swollen in her face, lower arm and leg, and felt heavy and lethargic. The pains were worst in wet weather and very much better in dry weather. She was a housewife with large family, and housework was becoming increasingly difficult. She found herself delegating more and more tasks to her family. She stopped menstruating 2 years ago. She had not suffered badly with hot flashes, but had put on about 13.5 kilograms in weight since then. She had pitting edema on her lower legs, and her face and forearms were edematous as well. She walked rather clumsy, as if her ankles were not bent. Her face was quite swollen. She weighed 95 kilograms and was 1.65 meters in height. These points were alternated with each treatment session to reduce the number of needles. So sa diagnosis, spleen dump cold, there is excess in blood, normal ang yin, deficient ang yang, and qi. Spleen stores urination for the body and circulates fluid in the periphery. The patient had put on substantial amount of weight in the past 2 years, yin excess, and had edema mainly in the lower arm and legs, and her face, which is damp stagnation. These two symptoms are sufficient to make the diagnosis of damp stagnation in the spleen. The pain was generalized in many joints, so we needed to treat it as a problem of the kidney and liver. The nature of the pain was fixed, not wandering, with pains when starting to move from rest and requiring 2 to 3 hours of movement to improve. This is a damp pain because it takes a long time and more movement to circulate fluid. It is also a cool pain as it worsens during rest while in bed in the early hours of the morning. The treatment should be to eliminate and circulate dampness and warm the joints. So treatment, it was impossible to treat such generalized pain with local points. So general treatment for dampness was considered. Spleen 9 sedation and stomach 40. Diuretic point and Lou point, these are the best points to treat generalized dampness. They eliminate and circulate dampness. UB20 needle and capping. Back shoe point of the spleen improves function, and capping is to remove dampness from the internal organ, which is the spleen. UB58 and GB37, which is the Lou points, used to tonify yang and sedate yin in kidney and liver. REN5 and REN9 needle and capping was given only in the initial 3 sessions. REN5 is the move point of the triple warmer. This combination of points are given in general edema and are very effective. Avoid fatty and milk foods, no refined sugar or carbohydrates, less salt in order to increase urination. She was treated 3 times in the first week and then twice weekly for a further 2 weeks. Her symptoms improved within the first week down to 50%. She was much better in the 3rd week. Further treatment once monthly was given for 6 months, during which time she also lost 15 pounds in weight and was her normal self again. Next, yin and yang combined states. Sabi ng author, as I have shown you so far, the treatment of musculoskeletal pain is chosen according to the differential diagnosis made based on the answers of 3 questions and examination procedures such as observation and palpation of pulse. A clear diagnosis leads the way to a good energy balancing treatment. When the symptoms are difficult to diagnose or the patient is not aware of their symptoms, we could end up providing poor treatment that does not give satisfactory results. But we should always try to be open-minded and find the actual imbalance of the problem. If not at the first consultation, maybe in the second or third session of treatment. The last category in musculoskeletal pain that I wish to discuss is combination of yin and yang dominant states. Generally, we should see either one in dominance, but we not all have patients who feel pain all the time, or patients with pain during rest and during activity. What could be the imbalance in these cases? There could be two possibilities. First, both yin and yang are in excess. Number two, both yin and yang are deficient. Thank you for your attention.
Thank you very much, Sir Dino. We call once again Ma'am Lynn Galarita for the meridian theory.
Good afternoon ulit. So today we're on our final topic on the extra meridian, which is the yin way or the linking, protecting yin linking or protecting meridian. Okay. So this extra meridian protects the yin energy of the body from leaking. The confluent point and common points can be used. So for the common points, we have kidney 9, spleen 13, 15, 16, liver 14, REN 22, and REN 23. As for the confluent point, we have pericardium 6. In the case of yin and yang deficiency of an organ, or when an organ has a functional qi deficiency, it is possible that fluids leak from this organ, thus further reducing the nutritional blood and yin of this organ. So examples of this are when there is edema in malnutrition, there's slow bleeding or spotting in spleen qi deficiency, there's dryness, excessive thirst, and excessive urination and diabetes, cold sweating in lung qi deficiency, chronic runny nose alternating with dryness in lung yin and lung yang deficiency, and excessive salivation alternating with dry mouth and spleen yang and spleen yin deficiency. In all these cases, there would be loss of fluid and not because there is an excess of it. It is necessary to tonify the qi or the yin and yang and use the yin protecting meridian point pericardium 6 to hold in the fluid. Okay. So to summarize our discussion on the extra meridian and how can they better be used, there are 7 extra meridians. So if there is, in the first condition where there is a yang excess in 3 elements, where the yang is in excess while the yin is still at the normal level, we could sedate SI3. This is the confluent point of the Du meridian. Or if there is yang excess in the motility meridian, you could utilize UB62. If yin is low in 3 elements, and the yang is still in excess, we can use REN 15, the low point of the REN meridian. On the other hand, if there is yin excess in the 3 elements, here we have in the tower diagram, we can see an excess yin and a normal level of yang. Here we can sedate Lu 7. And if the yin motility vessel is affected, we can use kidney 6. If the yang is low in the 3 elements, we can also use Du 1, which is the Lu connecting point of the Du meridian. If the vital meridian is both in excess, both deficient in yang and yin, where yang is slightly higher than the yin, we can use spleen 4 and kidney 11, 16, and 21. We can also tonify the yin and yang of the weak organ. In this case, if yin leaks, we can use pericardium 6, the yin protecting meridian. Okay. On the other hand, if there is an excess in yang and a very deficient yin, we can use REN 15, the loop point of the REN meridian. You can also use bladder 62, the yang motility of the yang motility meridian. And if the yang bursts and leaks, we can use triple warmer 5 of the yang protecting meridian. Okay. I hope this gives us a better understanding of the extra meridian. Thank you for listening.
Thank you very much, Ma'am Lynn. We now go to the final topic for this afternoon. Let's listen once again to Ma'am Teresita Sumile.
Good afternoon ulit, everyone, and Dr. Hector. Let's now talk about chronic fatigue syndrome and its etiology. The first etiology of chronic fatigue syndrome is overwork. Overwork means excessive mental work, working long hours without adequate rest for many years, working under conditions of intense stress, often accompanied by irregular diet. This weaken the kidney and spleen, and therefore lay the foundation for the development of either latent heat or a residual pathogenic factor after an infection. Indeed, in clinical experience, the recurrent clinical history is that a person who was working very hard contracts an infection. He or she disregards it and goes on working very long hours and never recovers from it. The next etiology is irregular diet. This means poor eating habits in the sense of eating under conditions of stress, eating while working at one's desk, eating in a hurry, eating late at night, and others. Secondly, the excessive consumption of sweet, greasy foods and dairy foods may predispose the patient to the formation of dampness. When he or she suffers an invasion of wind and a residual pathogenic factor is formed, this is very likely to take the form of dampness. Alternatively, if the patient develops the condition for the formation of latent heat, this may assume the form of damp heat. Next etiology is excessive sexual activity in men. This affects men much more than women, as sperm, which is a direct manifestation of the essence. Excessive sexual activity weakens the kidneys, and this is the background against which latent heat is formed or a residual pathogenic factor remains after an infection. The next etiology is emotional stress. It stirs the minister fire, and it may be the cause that makes latent heat emerge. Emotional stress also stirs the minister fire in the pathology of yin fire. Next is excessive physical work and sport. Excessive physical work, exercise, and sport weaken the spleen and liver primarily as they injure muscles and sinews. In some cases, they also injure kidney yang. A deficiency of these three organs may constitute the background against which latent heat develops or a residual pathogenic factor is formed. The idea that excessive physical exercise may be detrimental is now recognized in Western medicine, too, as we now know that excessive sport activity depresses the immune system. Next is antibiotics in the case of residual pathogenic factor. The effect of antibiotics from the Chinese point of view has already been discussed above. From the perspective of Chinese medicine, antibiotics kill bacteria, but they do not prevent the formation and a residual pathogenic factor. On the contrary, they are often the cause for the formation of a residual pathogenic factor as they weaken the stomach and spleen and therefore easily lead to the formation of dampness or phlegm. Next is immunizations in the case of latent heat. The effect of immunizations has also been discussed above. From the perspective of the 4 levels, immunizations consist of injecting a pathogenic factor directly at the nutritive Qi and blood levels in order to produce an artificial immune response. In most cases, this probably has no consequence, but in some cases, immunizations are a cause of morbidity as they create heat in the nutritive Qi and blood levels. In many cases, immunizations are the main cause of the development of latent heat. Thank you so much for your attention.
Thank you very much, Mom Teresita. And with this, we would like to thank everyone for finishing the course with us, all 64 hours of it. Congratulations, everyone. And we would like to invite you to our next series of lectures entitled Biomedicine, which is specifically designed for those who would like to hone their skills in medical acupuncture. Thank you very much, everyone, for joining, and hope to see you in our future lectures. Thank you, everyone, and God bless.